Welcome to Better Health Guy Blogcasts, empowering your better health. And now, here's Scott, your Better Health Guy. The content of this show is for informational purposes only and is not intended to diagnose, treat, or cure any illness or medical condition. Nothing in today's discussion is meant to serve as medical advice or as information to facilitate self-treatment. As always, please discuss any potential health-related decisions with your own personal medical authority.
Hello, everyone, and welcome to episode number 43 of the Better Health Guy blogcast series. Today's guest is Dr. Darin Ingels, and the topic of the show is overcoming Lyme. Dr. Ingels is a respected leader in natural medicine with numerous publications, international lectures, and more than 25 years' experience in the healthcare field. He received his Bachelor of Science degree in Medical Technology from Purdue University and his Doctorate of Naturopathic Medicine from Bastyr University in Seattle, Washington. Dr. Ingels completed a residency program at the Bastyr Center for Natural Health. Prior to attending medical school, he worked as a clinical microbiologist and immunologist at the Lutheran General Hospital in Park Ridge, Illinois. Dr. Ingels is a licensed naturopathic physician in the state of Connecticut and a licensed doctor of naturopathic medicine in the state of California, where he maintains practices in both states. He is board certified in integrated pediatrics by the American Association of Integrative Medicine. Dr. Ingels is a member of the American Association of Naturopathic Physicians, the American Association of Integrative Medicine, the International Lyme and Associated Diseases Society, the American Academy of Environmental Medicine, and many state associations. He is currently a board member of the American Association of Naturopathic Physicians. He's written a chapter on allergy desensitization for autistic children in Cutting Edge Therapies for Autism. He is the author of the upcoming book on Lyme disease, The Lyme Solution, a 5-part plan to fight the inflammatory autoimmune response and beat Lyme disease, coming in March of 2018. This book will cover an integrative, natural approach to the treatment and management of Lyme disease. Dr. Ingels' practice focuses on environmental medicine with special emphasis on chronic immune dysfunction, including Lyme disease, autism, allergies, asthma, PANDAS, recurrent or persistent infections, and other genetic or acquired immune problems. His practice is comprised of both children and adults, and he uses diet, nutrients, herbs, homeopathy, and immunotherapy to help his patients achieve better health. And now, my interview with Dr. Darin Ingels. So tell us about what drew you to the world of Lyme disease. Did you have any personal experience with Lyme? And if so, what did you find most helpful for recovering your own health?
Yeah, well, nothing like a little personal experience to gain some clarity. I was actually infected in 2002, shortly after I had moved to Connecticut. I was living in Seattle prior to that. And I got a tick via my dog at the time. And I'm one of the few people that actually had classic Lyme disease with the bullseye rash, the 105 fever, the headache, and so forth. And I treated myself with doxycycline. And after 4 days, I felt perfectly fine. And that lasted about 8 months. Unfortunately, I was 3 weeks prior to opening my own practice. So I was, the doctor, the receptionist, the bookkeeper, and working 10, 12-hour days. After about 7 or 8 months, it finally caught up with me, and I started getting symptoms again. So when I started getting symptoms, I started retreating with antibiotics. It didn't help. I changed antibiotics. It didn't help. And I really went down that cascade I think a lot of Lyme patients do of trying various antibiotics, different combinations. You just haven't found the right combination yet. And after 9 months of really being very, very sick from the antibiotics and losing weight and being nauseous all the time, I actually found a local doctor in New York City who treats with Chinese herbs. And I had several patients that had worked with him, Dr. Zhang, and he really pulled me out of the weeds. So that was kind of my introduction to Lyme. And then from there, of course, living in Connecticut, we see a lot of Lyme here. And now it's been, 16, 17 years and treated, several thousand patients, between personal experience and professional experience. I've kind of figured out, what seems to work best for folks.
Wow, that's great. So you are the classic example of the wounded healer then. So it's makes a lot of sense as to why you would then be drawn to take your personal experience and use that passion to really help your own patients.
Yeah, absolutely. And, I think, in many ways it was very good to have that experience, because I think this is what most people with Lyme at some point go through. You go through that point of, trying antibiotics, trying different ways to overcome Lyme. And I just felt like I kept hitting a wall. But it was really very frustrating in that, it was making me sicker in the process. And that's not the way that healing's supposed to work. And, I'm a naturopathic physician by training, and I know all this intellectually, but it was very hard when it came to my own health to apply the things I knew were really going to get me over the hump. So, it was a good lesson to learn, and having that, I think it's made me certainly a better practitioner in being able to apply it to other people.
Fantastic. So we know how hard it is to get really good positive lab results for both Lyme disease and for Lyme co-infections. What are some of the labs that you use to explore the potential for Lyme in your patients?
Yeah, like you said, the labs are mediocre at best. And I don't think that we've come across any one lab that has the golden ticket yet. So we're trying to piecemeal various types of lab testing to really figure out, if someone's had exposure. So, my go-to is still the Lyme Western blot. I think, we've got enough experience and evidence that at least gives some insight for some people. I was a microbiologist and immunologist before I was a doctor. I used to do this test for a living, so I know a lot about it. I've run thousands of them myself as a technologist, not as a doctor. And, it again, for the people that it comes back positive, at least it gives us some assurance that there's been exposure. And I think people really need to understand that that's all this test is really telling you is, have you ever had exposure? Theoretically, if you get bit by a tick and your immune system does what you want it to do, you're going to make antibodies. That doesn't mean you have Lyme disease. So we have to take that with a grain of salt, and with the understanding that the sensitivity of this test is very, very poor. So knowing all of that, I actually like using Medical Diagnostic Lab in New Jersey. I think they do great testing. IGeneX also does great testing. I sort of prefer MDL for two reasons. One is that they bill insurance. And so for a lot of people, that out-of-pocket expense with IGeneX gets to be a little bit rough on the pocketbook. I also like MDL because they actually send me a copy of the test strip. And as a former med tech and microbiologist, I know how to read this strip. I actually like to look at it myself, where IGeneX does their own interpretation. So for me, it's just kind of a personal preference, but I think their quality is both very, very good. So that's really kind of my starting point for Lyme and all the co-infections. I've also used a lot of the iSpot Lyme test, I think, in trying to figure out if someone has acute exposure, especially if they're in that window where perhaps they haven't made antibodies yet. I think that's a good way to at least see if there's any element of immune activation. And so I've kind of really stuck with those. Some of the other labs that are available, I've had very mixed results. There's one lab that I won't mention, but you probably know it, that's doing a DNA test. Every single one I've seen comes back positive. And as a former microbiologist, when I see every test come back positive, it makes me very suspicious about the validity of the test. So I'm a little skeptical about some of these newer tests, only in that either I don't have enough data to really see how good they are, or they're so new that other practitioners really haven't had a lot of experience with it either. So I like to stick with the ones that are a little bit tried and true. And at the end of the day, I think most of us are really treating you, the patient. It's based on your clinical symptoms. And I think people forget that even the CDC tells you this is a clinical diagnosis. It's not a lab diagnosis. And this test was never, ever intended to be diagnostic. They took a group of people that had known Lyme disease, drew their blood, looked to see what antibodies were there. So it was really used as a surveillance tool. And I think most doctors either don't know this or forgot about it, but it really is based on your clinical symptoms.
One of the things maybe you can clear up for us, since you've used a lot of the Western blot, is I see people that have maybe had Lyme for years, they get a Western blot and it comes back IgM positive, and thus they assume that it's a recent exposure. And my understanding is that Lyme is one of the few infections where the whole IgM, IgG for more recent versus longer term exposure doesn't really stand up very well. And you can have Lyme for many years and kind of cycle back and forth between IgM and IgG. Do you see that as well?
Yeah, that's absolutely true. Lyme, the rules of IgG and IgM really do kind of get thrown out the window, and that even the research supports this, that you can come in and out of being IgM positive even if you were exposed 20 years ago. So anytime you get any element of immune activation, you'll see that IgM level rise. And I've seen this in my own patients where we've done serial testing over the years. Sometimes their IgM's positive, sometimes it's not. Even with my own self, I've seen it come and go. I mean, I use myself as a guinea pig just to kind of see, but ironically, sometimes when my symptoms were worse, my IgM was negative, and when I was feeling pretty good, my IgM was positive. So, there really is no rhyme or reason to where those antibody levels tend to fall. So I certainly would never use it as a marker on how well you're doing. I think you really have to look at the person and how you're feeling. So for me, once I've established there's been exposure, I don't even bother running a Western blot again. I really don't see any clinical benefit to it, because if you're waiting for those antibody levels to drop away completely, that might happen, but it's not necessarily going to correlate with the way that you're feeling. And again, there's some pretty good research that antibody levels can stay elevated 20 years after you've been treated. So, I know some doctors like to test every 3 months, every 6 months. I really haven't found the value in that. So I'd rather save your money and apply that towards good treatment.
Well, and my thought process always was that Borrelia probably doesn't ever 100% get eradicated from the body, and doesn't really have to in order for us to be healthy again. And so to me, even if without having Lyme symptoms at this point in my journey, if I were to run a Western blot and it showed some antibodies, I wouldn't necessarily interpret that as a bad thing, because I would want my immune system to be responding in some way.
Yeah, and I feel the same way. I think, Lyme or the Borrelia organism is probably not something we eradicate 100%. And I think of it maybe a little bit more along the lines of Candida. Candida is part of you, but it can overgrow and it can cause a lot of health problems. I think Lyme can do the same thing. It can overgrow and cause a lot of problems, but if you can get it under control, you live with it, it lives with you, and you can live somewhat harmoniously. And I've seen this clinically in patients where they'll go sometimes months to years of really being symptom-free, and then something stressful happens in their life and they start to get symptoms again. So I think it definitely has the disposition to being opportunistic, that if your immune system takes a little bit of a hit, you become symptomatic again. But I think it's really about learning how to control the organism and keeping it at bay.
So when we look at Lyme and co-infections, which do you find to be the more challenging in terms of treatment, in terms of the symptoms that a certain organism produces in your patients? And then how do you go about approaching treatment of those specific, more challenging microbial issues?
Yeah, I think Lyme for me is still the most challenging amongst even the co-infections. If I had to rank them, I'd say Lyme can be the most challenging. Number 2 for me has probably been anaplasma. I've seen patients with anaplasmosis that's taken much longer to eradicate. And maybe number 3 is Bartonella. Ironically, I've actually had very good success with Babesia, and I find that one of the easier ones to get rid of. So maybe I'm just lucky. But Lyme is still the one I think most people tend to struggle with. And, my perspective on, Lyme and the co-infections is that, the infection's the initial problem, but beyond that, its capacity to trigger an autoimmune event is really the bigger problem. So I think when we're talking about post-Lyme syndrome, chronic Lyme disease, whatever you want to call it, what we're really dealing with is this, secondary autoimmune disease that's emerged as a result of having been exposed to the organism. And you'll find, when you go into the research, there's just a lot of data supporting this, that it can be Lyme, it can be really any other microbe. And once that ball gets rolling, I think it's easier for other things to kind of fall in suit, because I've seen it where it's Lyme, and sometimes it's strep, and sometimes it's mycoplasma. So I've really kind of tried to approach this where, certainly getting the organism under control and bringing that load down or bringing that body burden down is important. But the way that we really get people over the hump and get them symptom-free is really approaching it as an autoimmune disease, which then encompasses, all these other things we do to help improve immune function.
Perfect. So we're going to come back to, I think, the LDI and immunotherapy piece. But while we're talking about reducing body burden, are there specific herbal lines or protocols that really have emerged? I know you mentioned one already at the beginning of the conversation. Do you find that for the most part, these are responsive to herbs? Do you also incorporate antibiotics? How do you do that?
I think I've evolved in my life where antibiotics are really, really low on my list, and I rarely use them in my own practice or refer out for IV antibiotics. I've certainly worked with enough patients that have suffered at the hands of antibiotics, and that's not to say that for some people they aren't appropriate. And I've also seen people who've gone on antibiotics and did very well. I'm generally seeing the people who've already been on the antibiotic train. They didn't do well. They suffered at those hands, and so now they're looking for alternatives. So saying that, I've worked with a lot of different herbal protocols over the years. The ones that I tend to stick with the most, my go-to is Dr. Zhang. I like Dr. Zhang. Dr. Zhang, if you don't know who he is a Chinese medical doctor. He actually works as an acupuncturist in New York City. But he did a lot of research in the Chinese literature looking at spirochete illnesses, because in China, they have a lot of other spirochetes outside of Borrelia, particularly one called Leptospira. So he looked at a lot of traditional Chinese herbal formulas and then looked at the biochemistry of how these herbs actually work. And so he comprised these formulas that are kind of a half mix of traditional formulas with his own combinations of things that biochemically would help get these infections under control. So I like it because he really looked at the breadth of what Lyme's doing to the body. So it's not just about bringing the load of the organism down. He helps improve circulation. He helps boost the immune system. He's got some anti-inflammatory formulas. He helps break up immune complexes that can cause as a result of the autoimmunity. So it's one of the few protocols I've seen that really, I think, looks at Lyme from the 30,000-foot view. So that's been kind of my go-to, and clinically I find it to be one of the more effective protocols. I also like it because it's also one of the protocols I see the least herxing on. And nothing's worse when you're going through any treatment and you really feel horrible, and it's common with a lot of Lyme treatment. But strangely, I think because they're formulas and there's a lot of other herbs that help offset the other, that herxing is less common with his protocol than with any of the other herbal protocols I've used. The good news about it, again, clinically, I think it's very effective. It helps a lot of people. The downside to it is that it is a lot of pills, and if you're not a pill taker, that can be a little tough. And quite honestly, it's kind of expensive. For most people, it can run $500 a month, so that gets to be a little steep. So my feeling is, if it's doable, that's my go-to. Beyond that, I've sort of done a modified version of Dr. Cowden's protocol. And Dr. Cowden's protocol, because I work with a lot of children, is great because they're liquids, they're tinctures, they're very easy to administer to children, but they still work well for adults. If you follow Dr. Cowden's protocol as it is, every month for 5 months, you're changing different herbs, and it's usually anywhere from 8 to 10 of the formulas. I've kind of narrowed it down to about 4 of those formulas. And again, I find the majority of people respond actually very well to that. So it makes it a little bit more financially manageable, a little bit easier to administer. And so that's kind of been my number 2. And then beyond that, I've used Fiber and White, I've used Buhner, I've used Beyond Balance. They all work well for some people. So my conversation with people is, look, if you start down one path and you're not getting the results you want to see, don't feel afraid to switch to something else, because sometimes people do better on one herbal protocol than another for no logical reason that I can really see. The other thing I should mention about the Dr. Zhang, part of the reason I like it too, because it really does encompass all of the co-infections. It treats Bartonella, it treats Babesia, it treats Anaplasma. So you don't have to be as specific as you would with antibiotic therapy, where you really have to have a targeted drug. In this case, the herbs really have a broader umbrella. And even with the modified Cowden, Dr. Eva Sappi at University of New Haven's actually done a lot of research. And of course, she found that it was more effective than doxycycline, even looking at when Lyme moved into its cyst form, and it was also effective against other co-infections. So I think sometimes people feel like that they're missing out if they don't take the antibiotics, or somehow they're getting a lesser therapy. And that really hasn't been my experience, even for people that have neuro Lyme symptoms. So I think, if people start with one of those two protocols, they're going to be happy with the results.
Yeah, I agree. I think the herbal protocols that are available now definitely are not lacking in power and potential like they may have been a decade or so ago. The Cowden protocol, since you brought that up, one of the things that Dr. Shoppy has done some research around is the stevia. And I think one of the ones that she looked at was the one from Nutramedics from the Cowden protocol. There's a lot of debate online about whether or not stevia actually does seem to do anything for Borrelia or not. Do you have any clinical observations? Do people have Herxheimer reactions from the use of stevia?
My experience with stevia hasn't been fantastic. I mean, I've not seen anything majorly great. The issue I have with the study she done is that these are in vitro studies. I haven't really seen any human clinical studies. So I don't know the amount of stevia you can get in a person is going to be equivalent to what they're using in the in vitro study.
Okay.
So far, I can't say anyone's had a wow experience from using stevia. It doesn't harm anybody. I certainly have no problems if someone wants to try it. And I think it's hard too because I don't have anybody who's only doing stevia and nothing else.
Right, so of course, yeah.
It feel better, it might be hard to delineate that the stevia was really the key factor in them, feeling better.
So what role does detoxification play in your overall protocols? Is it a significant piece of what you're doing with patients? And then what are some of the things that you find helpful in the detoxification realm?
Yeah, and I'll sort of piggyback that I think detox is critical, if not one of the most key factors, but that's sort of in conjunction with gut function, because you can't really detox if the gut isn't functioning well. So, part of the program I run people through, the first step is really making sure that the gut functions well. If you've got someone who's chronically constipated and they're not detoxing well, and you start pushing their detox pathways, they're going to get sicker and sicker because they just don't have the right eliminatory pathways. So, yeah, I think detox is really part of the reason that people have some of these immune issues as they are. And what I hear in the history often is that even before they got Lyme or these co-infections, you can see signs where they were having, either poor detox, poor gut function, poor diet. There was usually something there ahead of time that the stage was already set, so that by the time they got infected, it just was able to kind of cascade a little bit faster. So some of my favorite detox therapies, honestly, my favorite is colon hydrotherapy. People get really weirded out by it, and it sounds kind of gross if you've never done it, but I've had patients that have tried every treatment out there, herbs, antibiotics, nothing helped them, hyperbaric chelation, and they did one colon hydrotherapy. Their energy was better, their aches were better. Again, we know from the research that this is a major way that we eliminate toxins, toxicants, heavy metals. So if people can kind of get over the mental hurdle, it's something that I find gives you the most bang for the buck. So I like colon hydrotherapy, and I'm also a big fan of sauna therapy. Again, Stephen Genuis has done a lot of research in sauna therapy and found that, when you do sauna therapy, you just liberate a lot of toxins from the body. It gets out of the organs, gets out of tissue, you sweat it out. So we can sweat out herbicides, pesticides, metals. A lot of it comes out through the sweat. So between sauna therapy and colon hydrotherapy, it's a really easy way to get rid of a lot of junk out of your body.
Do you find coffee enemas potentially helpful for some patients as well, or is that not something that you do?
I do for some patients. A lot of the patients I see are, I'll say, a generalized sort of weak constitution. I don't like the coffee enemas for people that have a weaker constitution. I'd much rather they just do a regular water enema. But if someone has a little bit stronger constitution, then yeah, I'll recommend the coffee enemas.
Perfect.
Coffee enemas are great just because you can do it at home. But it's kind of a one and done thing, where the advantage of colon hydrotherapy when you use a professional is that they have the ability to go through multiple fill and drain cycles. So by constantly stimulating, there's a nerve called the vagus nerve that goes along the whole line of your intestinal tract. When you stimulate that nerve, that's your big parasympathetic nerve. That's what gets your nervous system to calm down and relax. But it also what's allow your liver, your gallbladder to start dumping a lot of those toxins. So, people think that they do colon hydrotherapy just to clean out the colon. I mean, it does that, but that's not really the intention. The intention really is that nervous input that you get from the therapy.
Perfect. So one of the things that I learned from many years of following Dr. Klinghart's work is that his thought has been that the microbe itself is a very small piece of the symptoms that we have, but it's really around the immune modulation that you were talking about the over response to the bug, the creation of inflammation that results. So I wanted to talk a little bit about your thoughts around immune modulation. And I know that you look very closely at allergies in patients. I'm interested in what are some of the common allergens that stress your patients, and then how do you use sublingual immunotherapy to address those allergens?
Sure. So I see a lot of people after they've been exposed to Lyme or co-infection who never had a single allergy in their life, all of a sudden become highly allergic, highly sensitized. We'll see mast cell disorders that are somewhat new. So in terms of the type of allergens, it can be across the board. I've seen people develop food problems. I would say mold is probably the number one thing I see in terms of allergic trigger. Sometimes it's pollen, sometimes it's animals. All of a sudden they're allergic to the dog that they've had for 10 years, that kind of thing. So part of my process is to go through various types of allergy testing to figure out what it is that bothers people. And then once we do that, we can actually start desensitizing them with what's called sublingual immunotherapy. So as the name suggests, sublingual is under the tongue and immunotherapy is immune therapy. The concept is very much like allergy shots, except we don't inject it. And they've been doing sublingual immunotherapy in Europe for almost 50 years now. So it's nothing new. There's over 800 studies in the medical literature on this, but it's really a way of permanently changing the way that the immune system reacts to these different allergens. And the reason this becomes important is that pathway in the immune system that drives allergy is the same pathway that drives autoimmunity. It's this balance between what we call Th1 and Th2 cells. So most people who are highly allergic or highly autoimmune tend to be in a Th2 dominant state. So what we're really trying to do is tip the scales again back so that Th2 level drops, the Th1 starts to come up, because as your Th2 cells start to increase, they send a chemical messenger that suppresses your Th1, so it continues to feed that cycle. So what we're really trying to do is find a way to break that cycle and get the immune system more into balance.
So by reducing the allergic response, by reducing the Th2 response, you're essentially shifting things back to Th1, which means then that the immune system is better able to respond to the chronic infection burden as well. So this is indirectly kind of a way to address the microbial burden, correct?
Exactly. And, the Th1 response is really that response that's more responsible for, directly attacking the organism, the foreign invader, to eradicate it. So, when your Th1 drops, your susceptibility to just getting other infections is there. We always think of Th1 and Th2 kind of being like a seesaw. It's far more complex than that. But I think for practical sake, if we can think about just getting it really kind of on even keel, that's what we're shooting for, because we don't want Th1 to be too dominant either. We really need that balance between the two.
And is this sublingual immunotherapy, is this similar to LDA, or is this an entirely different mechanism that you're using or a different tool?
Well, in terms of LDA or low-dose allergy therapy, I think the mechanism is probably very similar. The dilutions are different, the dosing is different, but I think the end result is still the same, is that ultimately we're trying to retrain the immune system to stop reacting to these various allergens. So if you think about it, allergies are really overreactions of your immune system. Your immune system's reacting to something in the environment that shouldn't be reacting. Why is it you could have 10 people in a room and 3 people have pollen allergy and the other 7 don't, and yet they all live in the same environment? It's just differences in immune function. So ultimately, the goal of really any of these type of immune therapies is to start turning off that overreaction of the immune system.
I know that you also use LDI or low-dose immunotherapy as well. So are you finding that to be helpful? Are there certain microbes where LDI really shines? What's your LDI experience been?
My LDI experience, so LDI low-dose immunotherapy was developed by Dr. Ty Vincent, maybe close to 5 years now. We were actually the first clinic after Dr. Vincent to do it. We've known him for many, many years. In fact, we took over a practice in California for a doctor that had a lot of these antigens already sitting in his fridge from 20 years ago. So he was way ahead of his time, but he was using it in a different way. So we've shared antigens over the years. And, my experience for a lot of people has been very, very positive. I've had some people, again, who've done a lot of different therapies with minimal to no success, and we start doing LDI, and it's been a game changer for their life. I can speak for myself personally. When I started doing LDI, one of the things I had at the time, I was still having a lot of brain fog and some cognitive issues. And strangely, it wasn't the Lyme LDI that made the biggest difference. It was Candida. And I took that Candida dose, and within 24 hours, I felt and noticed a significant difference in my cognition. And I've seen that now, having used it with, several hundreds of patients, that, when you get the right dose and the right antigen, we see often positive changes very, very quickly.
So coming back to the Th1, Th2 conversation, are there ways that the balance can be tested in terms of lab tests? Is there some way to look at that?
No.
Yeah, that's what I thought as well.
Fortunately, all these tests are still done in research labs. We don't really have, because this what we can test are just for T cells. The markers on the cell surface are the same whether they're Th1 or Th2. So unfortunately, we don't have a commercial test available to be able to measure that.
Are there any other tools that you use beyond the allergy type therapies to shift the focus back to a Th1 response?
Yeah, there's a lot of things that we can do nutritionally to help shift that. And my number one go-to is glutathione. When you look at the research, when you've got someone in Th2 dominant state, inevitably when they look at intracellular glutathione levels, they're extremely low. And when those levels come up, the Th1, Th2 balance comes back almost to normal. So, glutathione, fortunately, there's several companies now that make a liposomal glutathione that gets absorbed very, very well. And I think, that's probably the number one thing that people can do to try and shift their balance back in. The other things that have been shown in the literature, I like resveratrol. I've been using a lot of resveratrol. That seems to work pretty well for bringing that back into balance. And of course, probiotics. Probiotics, even beyond colonizing the intestinal tract, actually plays a significant role in balancing Th1 and Th2. So those are probably my top three. And then just sort of generally antioxidants as a whole, whether it's, vitamin C, vitamin E, vitamin A, vitamin D, all of these antioxidants play a role in balancing Th1 and Th2.
Let's talk a little bit about pain and inflammation. So from an inflammation perspective, doing a lot of these immune therapies, allergy desensitizing, and so on, oftentimes does have an effect on inflammation. But what are some of the tools that you use in patients that really have a lot of pain, a lot of inflammation beyond those immune modulating type systems?
Yeah, so, again, I think there's some really wonderful herbs out there that can help modulate pain. So I've used curcumin, of course, which has been pretty well researched as a natural anti-inflammatory. I find with curcumin and Lyme, often I have to dose it pretty high for most people to really make a dent in their pain level. But that can be very, very beneficial. I'm also a big fan of Boswellia. I use a lot of Boswellia. If you don't know Boswellia, that's an Ayurvedic herb. There's a lot of formulas that contain Boswellia as part of it. That works really well. I've been using more for people who don't want to just take supplements. I've been using a lot now of PEMF, pulsed electromagnetic frequency devices. And I found that for a lot of people, that's really been fantastic at getting their pain under control. So for people who don't necessarily want to take a pill to manage it, this is a really great therapy now that you can even buy these little personal devices that you wear around your neck. And that can be beneficial because you can wear it all day, you can wear it at night. And like the one I have, you can actually set different programs for various things depending on what you're trying to accomplish. So I think this has been really very helpful. And then probably the last thing that I've used a lot of is low-dose naltrexone. I think low-dose naltrexone's been helpful for a lot of people.
Yeah, that's actually the thing I wanted to ask you about next. So the wearable PEMF device, is that something that people have to get through a practitioner, or are there some that are available commercially that people can go out and explore themselves?
No, you can just go out and get yourself. The one that I use is from a company called Lenosis. They're down in Florida. And I like it because it's about the size of an iPhone, and you plug it into your computer, but it has the capacity. It runs about 100 different programs. So there's one for stress, one for pain, one for Lyme. I mean, there's many. And as a practitioner, I can actually create the program for you, email it to you. You can upload it into your device, and then we've got you on a protocol we think is going to make a difference in your health. So that's one of the few I've seen, the personal ones that are really programmable. A lot of the other ones out there that I've seen are just kind of a set one size fits all. So I like the flexibility of having something that you can adapt to your own individual needs.
So let's talk a little bit about low-dose naltrexone. So how does that help people with pain, with inflammation, with modulating the immune system? How often would you say that patients report that they do have a positive experience with it? And then do they stay on it long-term?
Yeah, so the drug naltrexone, for people who don't know, was developed to help get people off drug and alcohol abuse. That's what was the original intention. What they found, though, at low doses, it has a very different mechanism of action. However, though, it does help bind to opioid receptors in the brain. And what they found is that it actually stimulates your brain to release your natural opioids. So these are your natural painkillers. So part of the way it's helping modulating pain is that it's just getting your body to make its own natural painkillers so that you're not relying on something externally. My success with LDN, I'd say somewhere between 50 and 60% of people tend to do really well with it. So it's not 80% or 90%. It's not as high as I would like to be. I'm not sure why some people are better responders than other. I haven't found that there's one particular group that does well over another. My feeling, though, is it's very safe. It's very inexpensive. So it's definitely worth a try. A 90-day supply for most people runs about $40 with the pharmacy that we use. So it's definitely worth a try. And in terms of how long people have to stay on it, most of the people I've had have been on it for a while. There is the possibility that when they start to come off, that their pain level starts to increase. So I don't see LDN as being the therapy that's going to get rid of their pain. It really is a stopgap treatment to make them comfortable while we're getting to the root of why they have pain in the first place. So I won't tell people that, if you just take LDN, your pain will go away completely, and then we'll take you off in a few months and you'll be fine. Because usually whatever it is that's triggering the inflammation or the pain, we have to deal with that cause. But the LDN is a great stopgap treatment to just help people be comfortable.
And does it also have some role in modulating the Th1, Th2 balance as well?
It does. And if you look at the research, and this is one of these cases where I was actually surprised there's as much research on it as it is. But there's over 40 studies on low-dose naltrexone, and they do find, again, it does help modulate the immune system and get this Th1, Th2 balance more in balance. So they studied it with Crohn's disease, they studied it with Hashimoto's, they studied it with multiple sclerosis, they studied it with chronic pain. So any of these autoimmune kind of conditions or pain conditions, they actually have looked at it and find it does help. If people are starting it, I generally start at a fairly low dose and then kind of work up slowly as needed. But again, the side effects are really very minimal. Some people do get some sleep disturbances, they'll complain of wonky dreams. But outside of that, it's very well tolerated.
Great. Let's talk a little bit about water damaged buildings and mold illness. How significant do you think that is for your patients, and how do you approach that issue?
Yeah, it's huge. I would argue that most Lyme patients I see, no matter where they live in the world, have some issue with mold. And when you look at the symptoms of mold toxicity or mold allergy, and then you look at the symptoms of Lyme, you'll see there's a tremendous amount of overlap. So I think clinically it can be difficult to distinguish sometimes, what's Lyme, what's mold. So, when I think of mold, you kind of have to look at it from two perspectives, especially in water damaged buildings, because you can get mycotoxicity. So these are specific toxins that certain molds secrete that you can breathe in and absorb. But you can also be allergic to mold. And that's an immune reaction to the mold spores. Or you can have both. So unfortunately, they're tested different ways. I think there are some doctors that tend to feel like the mycotoxicity is the bigger issue. My experience is that the mold allergy is the bigger issue. Sometimes it's both for patients. So often we do test for both and treat as needed. But just so people understand that there's two reasons that mold can bother you. You may have one or both of these issues.
And do you find that Candida, do you find that that is an issue that commonly needs to be addressed in your patients as well?
Yeah, almost always. And there's a lot of reasons we could argue that happens. I'd say most people I see have been on antibiotics long term, And certainly that sets the stage for having an overgrowth of candida and other types of yeast. But certainly a diet with high processed foods and sugar and other junky things, that can lead to an overgrowth of yeast. So inevitably, the overwhelming majority of people walking into my clinic, do tend to have yeast issues. So we'll usually do stool tests and urine tests to kind of get a sense of how bad it is, and then, start undergoing some element of antifungal therapy.
And it's interesting because I've heard a couple of practitioners talk about the fact that if you're living in an environment with mold, even though it's actually different than candida, that somehow makes it more difficult to treat the candida. And when they've had people then that have left a moldy home, it was much easier for them to address the candida issue. Have you ever seen that connection present as well?
Yeah, and actually it makes a lot of sense because they're both fungi. And even though they fall within different species, there is some element, genetically of how these fungi are related to one another. So, between mold and yeast, yeast are generally, single cell organisms that can make these things called hyphae. They're like little long chains. Mold themselves can make hyphae too. So again, there are some elements that tend to overlap. And yeah, I've had a similar experience.
And do you find that when mold is an issue in someone's home, do you find that remediation generally works? Do you find they have to move? How do you approach that?
Well, depending, again, what kind of mold's in the home and how extensive the remediation was or needed to be. Once you've been sensitized, certainly from a mold allergy standpoint, even once you remediate, you still have to deal with the mold allergy. The remediation is going to help with the mycotoxicity because now you're no longer having exposure to that toxin. So it's kind of like whatever your body got exposed to up to that point, now that kinds of stops. But once you've been sensitized to mold, because most places in the world have mold. So even though you get it from out of the inside of your home, you're still going to be exposed to it from the outside. And so that's why I can kind of argue that mold allergy often is the bigger problem because at least here in the Northeast, you can never get away from it. Unless we get sub-freezing days, there's always outdoor mold. And so I think people just have that constant exposure. And, in terms of mold remediation, I think the biggest problem is that finding a contractor who really knows what they're doing. I've seen plenty of people that told me they had mold remediated. They had a company come in and retest their home and still find they have sky-high levels of mold, that the contractor really didn't do their due diligence and fixing it the right way. So, if people ever do find they have a high level of mold, you really need to find a contractor who knows mold remediation well to ensure your health. But saying that, I have had patients that did have a terrible mold problem, did do appropriate remediation, and their health significantly improved after they got the house cleaned up. So it can really make a huge difference. And even though it tends to be very expensive, your health is worth it.
Absolutely. There's a lot of talk about the role or the connection between parasites and heavy metals, whether parasites are all bad or if they potentially have some role in modulating the immune system as well. What's your perspective on parasites? Is that a common issue for your patients, and how do you approach it?
Well, I wouldn't say that parasite infection is a common thing that I see, and I do a lot of stool testing. Again, I worked as a parasitologist, and I've looked at a lot of stool samples. I think beneficial parasites definitely play a role in overcoming Lyme. I personally take beneficial parasites. I find they help. I think, we've kind of been trained to think that all parasites are bad, but if you look over the years, once we started getting rid of parasites out of the food supply, we started seeing more allergies, more asthma, more autoimmunity. And if you look at, continents like Africa, where there's still a lot of parasites, their incidence of allergic illness is practically zero. Allergies and asthma are very, very low, and autoimmune disease doesn't exist. And I think there's a pretty good argument that part of that is that they still have this ongoing exposure to parasites that do have this immune modulating behavior. So, I think for someone who might have a bad parasite, not one of the good ones, we again have to kind of go back and look at the why. And I think if you have an immune system that's already taxed and doesn't function well, if you get Giardia or Entamoeba histolytica just through something you ate, it may be harder for your body to eradicate it. And obviously that overgrowth, much like an overgrowth of yeast or bad bacteria, can be very problematic, and it needs to be addressed. But I think that's more of the result of the immune system than the cause. And that's the way that I kind of approach it.
So the introduction of some good parasites also then has an immune modulatory effect and can help with some of these allergies and over responses, it sounds like.
Yeah, and back in the old days, they used to do a thing called TSO, which was a type of whipworm. TSO got to be very expensive and kind of fell out of favor. The one that Dr. Sid Baker talks a lot about is what's called HDC. It's Hymenalepis diminuata cysticercoid. It's actually a rat tapeworm. It has no capacity to infect humans. And what they found, though, is that this parasite used to get into grain beetles. And the grain beetles would get ground up in our grain. And so every time we would eat grains, we actually were ingesting a little bit of these parasites unknowing to ourselves. But that's how our gut would get exposure to it. And again, causes no problems for humans. But again, it does seem to have some sort of immune modulating effect. So there's a doctor down at Duke University, Dr. William Parker, and he's actually been doing a lot of research on these HDCs. And, most of what he studied is with MS, but we could argue that there's a lot of close relationship between Lyme disease and MS. And, his research so far has been very promising that these HDCs do have this immune modulating behavior and actually can help reverse a lot of the effects of MS. So I said, I take it myself. I've used it on a handful of other patients who are willing to again, get over the mental hurdle of swallowing parasites. But in those who are willing to do it, again, I do see it work pretty well. And I actually use it a lot with my autistic kids and find they benefit as well.
Fantastic. That's great information. Do you have very many patients that are EMF sensitive?
A lot of them. I think, the nature of any type of persistent infection is that it tends to damage the immune system. It tends to damage your hormone system, your endocrine system. And in that, I see people become very hypersensitive to a lot of things. Again, it could be food or mold or pollen, but along that can also be chemicals and it can be EMFs. So, I think there's sort of a hierarchy as your sensitivity level gets worse and worse. Chemical sensitivity tends to be at the top of that pyramid, and perhaps EMF sensitivity is the pinnacle. And depending on the person and how long they've been dealing with this persistent, issue, sort of, I think, leads to where that might go. But for the people, who have that sensitivity, I think, they have to be very cautious living in a modern world where EMFs are all around. So I do have a lot of people that we talk about, turning off the Wi-Fi at night, getting the smart meter out of the home, getting rid of the wireless router and hardwiring everything in. Having a home evaluation to see where the EMFs are highest in the home. Because sometimes, I had a child actually who was a terrible sleeper. The family did an evaluation, found that the wall that his headboard was on just had a terribly high EMF output. It seemed that there was just a lot of wiring run through there. So all they did is move his bed to the other wall, and then he started sleeping perfectly. So, because we can't see it, feel it, taste it, we kind of forget about it. But because it's all around us now, all the time, I don't think we fully appreciate how much it can affect you when you've already been sensitized. So I think it's a good idea that we limit our access to these products because, I think we're still very early in understanding how much they really affect our health long term. It's only been out now for really 10, 15 years, at least to the degree. And of course, it just gets more and more every year. So we don't have 30, 40-year data to see what's happening to people.
We are part of the experiment.
Exactly. So I think we'd all rather not be guinea pigs. We got enough issues on our plate. Why add one more problem unnecessarily?
Absolutely. What are some of the lifestyle considerations that are really critical to consider and think about when recovering from chronic Lyme?
First and foremost is sleep. I can't underline how much sleep is important for getting over any chronic illness. And again, most people, I experienced it when I first had Lyme. I've seen it in almost probably 90% of the Lyme patients I work with have some element of sleep problem. So getting good quality sleep is really important. And perhaps this ties back into the whole Wi-Fi thing. Come on, how many people do you know when they crawl in bed at night, pull their iPad in and play Words with Friends and Candy Crush and, answer email? It's like a time to get it done. And so people do that. But, that blue light that comes off, we've now got pretty good research on how it's interfering with our sleep cycle, plus the Wi-Fi. So I think we need to kind of go old school and get back in the habits of, really after dinner, starting to get our bodies prepared for good sleep. And I think when you look at some of the sleep research, we know that 9 p.m. to 3 a.m. is kind of this magical time where you're most likely to get that good, deep restorative sleep. So the more of that window that we miss, the harder it is to really get your body to recover. And I think, just lack of good quality sleep for most people is why it's so hard to get over this hump, even when you're doing all these other therapies. So if there's one lifestyle thing I can impress on everybody, is do everything you can to get good, deep restorative sleep.
And for me, that would look like sleeping in a Faraday cage, which most people laugh about, but it actually does work really well to reduce the EMFs and really help you sleep well. So it is something I've done for about a decade, and I think it was really critical. Let's talk a little. Yeah, go ahead.
Oh, I was just going to add, it sounds kind of stupid. I don't know if you know Dr. Bill Ray in Dallas, Texas.
I do.
He's kind of our forefather of environmental medicine. And he'll even have people take and cover their whole inside of the room with aluminum foil.
Mm-hmm.
And it sounds completely stupid, but again, it actually does help reduce that EMF from the outside. And, maybe you don't want to, make your whole room aluminum, but you could probably be very creative and come up with some sort of, shield just to help, block some of that external EMF. And again, I've just heard this from countless people now where when they do something like that, it really does help improve their quality of sleep.
Yeah, absolutely. There are many people that have talked about different diets that should be good for people with Lyme. What are your thoughts on diet? What kind of diet do you generally recommend for your patients?
Yeah, I've tried a lot of different diets with people, and I know the autoimmune paleo diet is very popular amongst a lot of Lyme folks. What I've found and what I talk about in my book is really promoting an alkaline diet. And, it was kind of interesting when I was doing research. There really isn't a lot of research on an alkaline diet, which is pretty funny considering it's been around for decades and there's countless books that are written on it. But I think if you look at the concept of what it's doing, it makes a lot of sense biochemically. If you look at your cells and how they function internally, they function well at an alkaline pH. And with the exception of, the stomach, the bladder, and for women, the vaginal area that's very acidic, the rest of our body is actually very alkaline. And at least in the few studies that were done, they did find a lot of health benefits to an alkaline diet. So, I think where it ties in with Lyme is that, foods that are more acid forming in the body, we know that acid forming things tend to create more inflammation. So this is another way of reducing inflammation. And the biggest distinction between an alkaline diet and the autoimmune paleo diet is really about animal protein consumption. A lot of people know when they say they're going paleo, they just eat a ton of meat. And on that diet, that's kind of okay. But what we find in an alkaline diet is that, meat and animal protein sources, because of their nitrogen content, tend to be very acid forming. So, I kind of think about our paleo forefathers, and I'm guessing what they ate probably was closer to an alkaline diet because they probably didn't kill every day. Meat was probably kind of a treat when it was available. So they probably ate mostly things they could pull out of the ground, off a tree, off a bush. So if you think about it really being a mostly vegetarian diet with really trying to keep your animal protein intake to less than about 20-25% a week, and then there's certain foods that I advise staying away from, which is basically junk foods, processed foods, dairy, and the one actually that's a killer for most people is coffee. I love coffee, but I find if I have a sip of coffee, my neuropathy will flare in no time flat. So it's just not worth it. So these foods that are very acid forming, depending on your sensitivity level, you may find that even just a little bit or that little cheat isn't worth it. So I advise people, I'm like, hey, look, try it for 6 weeks, see how you feel, see if you notice a difference. And if you do, great, we're on to something. And if you don't, we can try different diets. But I have a lot of people now, because the keto diet is the rage and everyone wants to go on a keto diet. Again, I think the keto diet's fine. I know it helps some people, but it's a much, much more restrictive diet. So for people who don't think they can really stick with that, I think the alkaline diet is a very reasonable, satisfying diet that's just doable for people.
I guess I'm blessed with my strong distaste for coffee, and it served me well in the realm of recovering from chronic Lyme. What do you think about the use of baking soda or apple cider vinegar in support of this goal of being more alkaline?
Yeah, I use a lot of it. So I think, any kind of bicarbonate formula is going to be very beneficial. It's a way to kind of cheat to help get your body in that alkaline state. And, even for just reducing allergies and asthma, I mean, environmental medicine doctors have been using this for 40 plus years. We know that clinically it works. There's no research on it, but we know that it helps. So whether it's Arm & Hammer baking soda, we use Trisalt, which is just a pre-made bicarbonate formula. I use Alka-Seltzer Gold, apple cider vinegar. There's kind of, different strengths of bicarbonate depending on how alkaline you want to go. But I said I've had kids in the middle of an asthma attack take Alka-Seltzer Gold or Trisalt, and within an hour their asthma stops. So we know that you can really help reduce that load of allergy. And I think because it's a similar mechanism, we're also helping reduce some of that autoimmunity.
And it seems that those same things pull people oftentimes out of a Herxheimer reaction as well. I think Alka-Seltzer Gold is one of those things when you mention it to someone, they think that it doesn't make a lot of sense, and then they try it, and it actually oftentimes seems to really make them feel a lot better.
Yeah, and Alka-Seltzer Gold is mostly potassium bicarbonate, where regular Alka-Seltzer is sodium bicarbonate. And again, we know that potassium bicarbonate is actually a better alkalizer than sodium bicarbonate, which is also what Arm & Hammer baking soda is. So yeah, I'd rather people use the potassium bicarbonate if they're really herxing. And so that is one of my go-tos when people are having a herx reaction, is just start taking, Alka-Seltzer Gold every couple of hours. It might give people a little bit of loose stool, but often it will blunt that reaction and just make them a little bit more comfortable in their skin.
So I think the mental, emotional realm is really important in chronic Lyme as well. And so I know you've talked about adverse childhood experiences, or what are called ACEs. How do those impact people dealing with Lyme? And what are some of the ways then that they can approach mitigating those early childhood experiences on their adult health?
Yeah, so there's been some really interesting research by a woman named Dana Nazakawa, and she actually wrote a book about it. It was really kind of coming out of her own experience with some of the early trauma she had as a child, but she started to realize how much these early events were impacting, her life, much later. And so the research she's done is looking kind of the same thing. So I think it's very easy with these early traumas, and I'll say it's not just childhood. I mean, this can be something that happened, when you were older, but these earlier traumas that, if we really haven't learned to let go of them and they're still stressing us, it's that stress impact that's really affecting our immune system, affecting our sleep. And so, the way that I try to broach it with patients is, getting them in the hands of a good therapist, getting them into some sort of, meditation practice, finding those ways that you can basically help, deal with some of those issues, take that stress off your body, which ultimately is going to help, your immune system function much, much better.
Fantastic. Tell us a little bit about how people can learn more about your work. I'm excited. I know you're about to come out with a new book early next year. Maybe you can tell us a little bit about that as well.
Sure. So yeah, we just finished the final editing stages. I have a book coming out on March 27th of 2018, so about 6 months away, but it's called The Lyme Solution. And it'll be available, through Amazon and all your major retailers. So it is, we've kind of talked during this podcast, it's really, I think, a natural way to approach Lyme disease. And it was designed to be a self-help guide for Lyme patients so that 90% of what's in the book you can do on your own. So I really want to empower Lyme patients that, you can get over this hump and you can do a lot of it on your own. So if you live in an area where you don't necessarily have a lot of practitioners available, a lot of this you can implement, on your own. There's a diet that you can follow. I've listed all of the herbal protocols that we've talked about and more. And I've talked a lot about other nutritional things that you can do to help with your energy, with your neuropathy, with your sleep, a lot of these common things that tend to plague patients. So it really is a way that, a 5-step protocol that every person can walk through. And if they need a little bit of help from a practitioner, I've got one chapter on, okay, here's some stuff you might need a practitioner for, but really most of the book is designed for things that you can do on your own. So if you visit my website, it's DarinIngelsND.com. It's DarinIngelsND, and is in NancyD.com. If you sign up for our list, I'll give you a free ebook on my top 10 immune boosting recipes. And then we'll certainly send out an announcement as we get a little bit closer to our launch date, let you know when the book's ready. And we'd love for you to join us. I put a lot of information out about Lyme disease and other chronic issues. And so if you just want more information, you want to stay in the loop, we've got a lot of great stuff for you.
And tell us a little bit about your practice as well. If people are interested in working with you as a doctor, are you taking new patients? I know you have a few different offices around the country. How does that work?
Sure. So right now, I split my time between Connecticut and California. So I have an office in Fairfield, Connecticut, and Irvine, California, which is Orange County, California. So if you go to my website, I've got all the information there. But if you're interested in becoming a patient, I do have a little bit of a wait list, but it's not terribly long. So if you want to contact my Connecticut office, that number is 203-254-9957. And my California office is 949-551-8751. So give us a call and we'll give you all the information.
What are some of the things you do on a daily basis in support of your own health?
Well, I'm trying to get better at it. Being a bi-coastal practitioner and being on always a different time zone has made things a little bit challenging. My newest thing now is I'm trying to learn how to meditate. There's a lot of good research on mindful meditation. And what I like about it is that it really doesn't take that much time. And so even if you're someone with a very busy schedule and kids and family, and you just don't think you can squeeze it in, you can squeeze in 5 minutes. And that health impact of what that 5 minutes can do for you is really amazing. So I'm now in the process of when I wake up in the morning, I try and get my 5 to 10 minutes in at least of meditating, focusing on my health. And I think that's something that anybody can do anywhere. And what I'm finding is that it's really hard. It does take some practice. But after now having done it a while, it's getting easier and easier to kind of get into that sort of, meditative, quiet state, get my brain to stop thinking about all the things for the day and everything I have to do. And again, that's something I would highly recommend for anybody out there.
Fantastic. This has been a really great conversation. Lots of good information. I think people will definitely benefit from it. I'm personally excited about your book. So as soon as it's available for pre-order, I want to make sure I get it ordered as well. So thank you for spending time with us today, for sharing your knowledge and wisdom and your personal journey and helping other people. I appreciate it. And it's been fantastic having you on the show.
Great. Thanks, Scott. I enjoyed being here.
Thank you very much. To learn more about today's guest, visit DarinIngelsND.com. That's Darin, D-A-R-I-N, Ingels, I-N-G-E-L-S, N as in naturopathic, D as in doctor.com. DarinIngelsND.com. I appreciate your support of the Better Health Guy blogcasts series. If you'd like to follow me, you can find me on Facebook and Twitter as Better Health Guy. The show can be found on YouTube, iTunes, Google Play, and Stitcher. If you'd like to support the show, please visit betterhealthguy.com/donate. And if you'd like to be added to my newsletter, please visit betterhealthguy.com/newsletters. I'm looking forward to many more shows ahead and appreciate your interest.
Thanks for listening to this Better Health Guy blogcast with Scott, your Better Health Guy. To check out additional shows and learn more about Scott's personal journey to better health, please visit betterhealthguy.com.